Okay, so thank you so much, Dr. Sushil, for the introduction. And I really feel honored to be a part of this international conference on advanced artificial intelligence in multidisciplinary research. And I want to congratulate all the chairperson and organizers to organize this international conference where everyone is participating from different part of India as well as other countries also. So, especially my thanks goes to Dr. Sushil Singh, sir, who gave me this opportunity to share my knowledge and be a part of this conference. So, in this session, I'll be covering small about the bridging the gap, that is about the digital technology. So, how these digital technology is transforming the laboratory diagnosis in the health services. So I'll be just discussing about the short, and we'll be discussing about what all are the key challenges with the people who are living in the remote area and how these digital technology are important and how they are solving the situation like which are facing by the people who are living in the remote area, and how these technology are helpful for the timely diagnosis and treatment of the people living in the remote area. So starting with the rationale. So as we all know, like diagnostic is the critical part of the healthcare system, and digital technologies, this is the new normal in the healthcare system. So various studies have shown that expenditure for the diagnostic is a major part of the healthcare expenditure, contributing the out-of-pocket expenditure. And implementation of the medical digital technology can provide the better accessibility and flexibility of the healthcare for public health. Objective of this session, like how this by using these digital technology, people are can get the easily approach towards the diagnosis, how we can use these technologies, and those are very easily accessible. By using them, we can timely diagnose the disease and start the treatment of the needy people who are living in the remote area, and reducing the out-of-pocket expenditure, early detection of the disease, thereby increasing the quality of life of these people, and to initiate the appropriate treatment based on the accurate diagnosis and rational use of HR. Like HR, like people in the healthcare system who are working in the remote area. So how we can utilize these people by giving them a proper training of these digital tools. Okay, because they are just sitting there, and if no digital tool, maybe if no such kind of tool we are using, means they are just idly sitting, we can train them and we can teach them like how these tool can be used, and how the screening process or how these devices can be helpful in the diagnostic of the needy people. So just a minute. So what all are the challenges for the laboratory diagnosis in the remote area? So if we talk about the challenges, so as we all know, there is limited access of the laboratories in the remote area, because it is very hard to construct new building or setting up the diagnosis, good advanced diagnostic in the remote area. So even and the second one is infrastructure gap. Even if you are going to set up a good laboratory in these area, then also it is very difficult to provide the continuous electricity supply or internet connectivity, and the continuous supply of the consumable and maybe proper maintenance of these machines. So it is very hard to setting up the laboratory, as well as there are infrastructure gap and shortage of healthcare professionals. So as we all know, in the remote area, it is very hard to get the medical health expert who can diagnose you accurately. Okay, so there are shortage of healthcare professionals also. So next is leveraging the mobile devices for point of care testing. So by using these digital tool, what all we can do, accessibility, right? So these tool brings the diagnostic advantage or the diagnostic service at the field level for the undeserved population. And they are the efficiency, you can reduce the turnaround time for the test result. Suppose that if you are having some sample for the testing, so it will take long time if you are going to collect the sample and transport it to the laboratory, and laboratory is not available in the remote area, then you have to send it to the some center. Okay, but if you are having some digital tool at the field level, primary screening can be done at that place only. So thus you are reducing the turnaround time also. These are the cost effective. Yes, we all know, suppose that if you are going for the RT-PCR, suppose that the COVID-19 is the best example. So if you are going to collect the sample and going to conduct a test like the RT-PCR, which is a very expensive test. So in comparison to that, these digital devices are cost effective also, which you are using at the field level without using the expensive chemicals or the consumable, and reducing the turnaround time also. Scalability, it is very easy to deploy these kind of the tool at the field level, where you can screen the large population at the field level. And resilience, that is strengthen healthcare system at the disaster prone region. Suppose that again, I'll say like COVID-19 is the best example. At the time of COVID, sample load was too much, but we were using some kind of the mobile apps, some kind of rapid testing kit, so that the burden of the laboratory for the RT-PCR testing may be reduced. Like primary screening can be done at the field level, thus you are reducing half of the sample. The sample which are really need to be tested at the laboratory for the standard test, then that only we are going to transport to the main laboratory. So this is how you are strengthening the health system also. So I will talk about the integrated public health laboratory. So if I talk about the Chhattisgarh, in Chhattisgarh, there are the public health laboratory, which we call Hamar Labs also. Those are launched in February 2020 by the state government of Chhattisgarh for the strengthening of health services. They offer around 120 tests, which include the blood, hormone, electrolyte, including the screening for the cancer, as well as tuberculosis also. And these tests are based on the fully automated digital machine, which reduce the turnaround time, and as well as the government is doing all these tests free of cost for the public health. So these are the few example of these digital tool, like portable PCR machine, glucometer, portable immunoassay analyzer, hemoglobinometer, automated blood pressure monitor, and skin cancer imaging tool, portable biochemistry analyzer, portable breast cancer scanner, colposcore for cervical cancer. So these are the tools which we are using for the screening at the field level or at the sub-centers. So now coming into NCD, those are the non-communicable disease. So like we see, like people are looking very normal in India, right? But if you see the NCD, it contribute around 5.87 million. That is 60% of all death in India due to NCD, non-communicable disease. So here I'm sharing the data from the Chhattisgarh, which the data as per the 25th December 2024. If you see the indicators, here they are doing the test for NCD. Those are the hypertension, diabetes, and oral cancer screening, breast cancer screening, and cervical cancer screening. So I just want to say, like, screening for such kind of NCDs is very important, even if you look normal. Like government suggests, like the women for the particular age should go for the breast cancer screening. We should do like our this sugar test or the hypertension test for the normal people also, because most of them, they even don't know like they are under disease condition. So here is the data which I'm sharing from the Chhattisgarh. So if you see for the hypertension, the total screening done by using the digital point of care device, that is 82.4% for the hypertension, and for the for the diabetes also, this is 82.4% of the targeted population. So here also the digital point of care device is playing an important role for the screening of the individual. Additionally, in 2023-24, 140 healthcare workers who covered around the 7 lakh population for the screening of hypertension by using the digital BP monitor. And if I talk about the other digital technology, that is digital health ATM and at Dantewada, Chhattisgarh, where they are testing around 40 different type of tests, which include cardiac checkup, diabetes, infectious disease, lungs, and lung diseases, respiratory checkup service by using the digital health ATM. So this is how the digital technology is playing an important role for the screening of individual, for the screening of the people who are living in the remote areas. So burden of breast cancer in Chhattisgarh, if you see, it is 142.55 prevalent cases in per lakh female of all age group, and 262.21 prevalent cases per lakh for the female who are 25 plus year. So looking at the data, like the burden of disease, it is prevalent. So government of Chhattisgarh initiated a pilot project for the screening of breast cancer in the Durg district of Chhattisgarh by using the digital point of care device. So this was the pilot project plan, where they included the 2 blocks, that is Nikum and Patan, where we covered the 6 PSC and UPSC. And in this pilot project, we used the 12 point of care digital devices for the screening of breast cancer. So here, just to motivate the normal population, the collector from the Durg district of Chhattisgarh, she also got herself screened for the breast cancer by using the point of care devices to motivate and to spread the awareness among the female who were living in the district. So this was very good initiative by the government of Chhattisgarh for the Durg district of Chhattisgarh. So these are the data. So before using that digital point of care device, we trained 1 medical officer and 2 staff nurses. 1 medical officer for the 1 month and 2 staff nurses for the 15 days, like how to use that device in a proper manner to get the accurate result. So total number of healthcare facility area covered are 15, and total number of staff involved in the screening are 33. Out of 33, 10 were doctor and 23 were the staff nurses. And average screening per trained staff with the point of care devices was 384. And average screening per facility was 846. And maximum screening conducted at CSC level, Patan, that was 2,210. And at the district hospital Durg, that was 1,840. And these are the results. So total screening, which was done by using the digital point of care device, are 12,686 females, and suspected were 573. And out of them, confirmatory test was done for the 112, and confirmed diagnosis made for the 96 individuals. And out of 96, 92 underwent for the treatment of breast cancer, and 4 of them undergone the treatment of surgical surgical treatment. So these are the pictures from the screening camp, which was done at the Durg district of Chhattisgarh for the female, the targeted group. So if you see, in a single day at the district hospital, we screened around 1,378 women, just to motivate them. And This is also like picture from the sub-center that is Ayushman Arogya Mandir. So why the digital screening initiative at the district level? So why it was important? So as we all know, like screening and treatment facilities available only in the tertiary care hospital, not in the remote areas and the regional center. So it is very difficult to reach the people from the flung areas, and very high case load at the tertiary care hospital, because we are having this cancer center at the tertiary care hospital. So there already we are having very heavy load of the patient, limited availability of the specialist, and long waiting time for the patient. And it is also very high out-of-pocket expenditure. So it was very good idea to screen out the women by using this digital tool for the at the field level for the primary screening of the breast cancer. So coming to the other NCD, that is your chronic kidney disease. So if you see the burden of CKD, chronic kidney disease in Chhattisgarh, that is 81.3 individual per population from the all age group due to all causes, and 14 per thousand population of the all age group due to diabetes mellitus, 1.9 per thousand population all age group due to the hypertension, and 2062.61 cases per lakh female who were the 25 plus year old. So here we took the initiative for the screening of CKD also at the Supabeda Blaze of Chhattisgarh by using the fully automated biochemistry analyzer, where we screened the patient from the field level around 5,365. So all these tests were done at the public health laboratory by using the fully automated device, and there was continuous supply of the reagent, and proper training was given to the MLT or the senior technician, and regular reporting and maintenance of the data was also done in the digital platform. So by this digital screening or the initiative was taken at the field level, again, poor facility for the screening for the CKD at the government health facility, and treatment facility dependent on mainly on the private hospital and only selected medical college. Very high, again, very high out-of-pocket expenditure and adverse impact on socioeconomic status of affected family. So here, if you see the Chhattisgarh data, here one village we are having the Supebeda. There we are having lot of patient of CKD, kidney disease. The burden is very high for the particular reason. And again, if we talk about the other digital tools, so now these digital technology are also we are using for the screening of the cancer, that is cancer of the like mouth, oral cancer, as well as for the cervical cancer. So this is the data which has been published in a particular journal. I have given the reference here. So if you see, this is the M Health app, which was used in Chhattisgarh as well as Madhya Pradesh, MP also. So they say is like by using this digital app, they screened around 8,686 people. And if we see the positivity rate, it was the 28% for the cervical cancer, of whom only 37% attended for the follow-up, and 5% positivity for the oral cancer, of whom only 31% attended for the follow-up. So again, like we need to see for the like this kind of digital app can be used for the screening of the cancer also, maybe for the cervical cancer or the oral cancer. But again, we need to check the sensitivity and specificity of such kind of tool. What is the validity? What is the accuracy of these tool? Like, and we need to see whether how much they are up to giving the accuracy, to what level they are accurate, giving the accurate result. So I'm not sure, like it is showing the a very good sensitivity and specificity, but yes, such kind of activity are being done, and again the digital technology and again the AI is playing a very important role for screening for primary screening of the disease at the field level. At least even if the sensitivity and specificity is 70%, then also like primary screening can be done at the field level without using the big infrastructure or the expensive tests. So it is somehow helpful. So talking about the hub and spoke model, so hub and spoke model, this is a centralized system where sample can be collected. So these for these kind of tests, if we talk about the hub and spoke model, these tests cannot be done at the field level. But yes, here you can collect the sample from the field level, from the PSCs, that is your primary health centers, and you can transport them to the CSC for the testing and processing along with the patient detail. And then after processing of the sample, result can be digitally shared to the registered mobile number. So patient can get the all test result at their mobile number, which reduce the reducing the turnaround time. So Telangana, if we talk about the Telangana state, Telangana is a best example for the hub and spoke model, where they are having the 20 hub support to 489 health facility. So they are having the 20 hub which are supporting the 489 health facility. And on an average, they are doing a wonderful job. They are testing around 44,000 tests for the average sample, 23,000 in a day. So this is also like digital, technology and involved here. Like, yes, you are transporting your sample, and then whatever the results are there, that you can sharing with the patient their registered mobile number. And again, coming to the telemedicine and remote consultation for the diagnosis. So once the patient is getting all the result with them, right? So this is a kind of platform, virtual platform, where you are having health expert. Okay, you connect with them, and you can share your data and information, whatever the result you are getting, whatever the diagnosis you are having, you can share with them, and you can get the view. What is the view? So they can tell you, suggest you, okay, this is the further procedure you need to require. This is a treatment based on these data, based on these test results. This treatment should be done. So the telemedicine is also playing a very important role for the people who are living in the remote area. They are getting the good consultation from the health expert, because we are lacking the health expert in the remote area. So this is how we can enhance the patient care virtually. Now coming to the cloud-based data management and analysis. So secure data storage, yes, provide the secure data and reliable data storage for the laboratory result, patient record, and other medical information, ensuring the data integrity and accessibility. Remote access, healthcare professional can access the result, and they can analyze the lab data remotely, and this enable efficient monitoring and follow-up for the patient. Data-driven insight, data analysis and visualization, allowing for the identification of what is the trend and pattern of the disease in the lab result, and leading the better understanding of the disease and patient outcome. Coming to the utilizing artificial intelligence for automated diagnosis. So automated analysis, AI algorithm can analyze the laboratory data and generate the preliminary diagnosis, and assisting the healthcare provider in identifying the potential condition and suggesting the further investigation. So based on your history, based on your data and information of the many patients, they can suggest you like what is the further investigation needs to be done, enhance the accuracy. Also, AI can improve the accuracy by diagnosis by identifying the subtle pattern in lab data that may be missed by the human error, maybe human observation, which is we make like human error. So, and next is efficient workflow. So AI powered system can automate the repeated task. So manual work you can reduce, such as the data entry and the result interpretation, and predict diagnosis. So this we all know, like AI take advantage of the digital data to integrate the health record, symptom profile, demographic profile. They use like what is the pattern of disease and other patient information to predict better diagnosis and recommend further treatment. The next is digital technology used for laboratory diagnosis. So what all are the challenges? So data privacy and security. So this is a very important thing. So it is very important to keep the information like patient as well as the healthcare professional information to keep confidential. It is very important. So that we need to look at, and the accuracy and reliability. So systematic analysis of the data with comparative analysis of clinical gold standard examination and the point of care device need to be done. So you are getting my point, means so whatever the things we are using at the field level, we need to compare with the gold standard, which we are using at the good laboratory to see the what is the accuracy of the these tools, right, in comparison to the gold standard. So we need to keep on doing such exercise also. Ethical issues, the AI-powered diagnostic raise the concern about biasness in algorithm, lack of transparency in decision-making process, compliances with the regulations. So we need to follow all the law and guideline. We need to ensure that the patient data handled correctly and protect both patient and healthcare provider. Training and dependency. Sufficient training needs to be done for the staff which who are using these digital tool. Okay, they need to train properly before using such devices. So insufficient training can compromise the patient care as well as the diagnostic outcome also. And procurement and use of the point of care device. So it is also difficult. Sensitivity and specificity of point of care device need to be validated, and capacity building on the use of point care device. And it's to be done, and mobilization of individual for screening, tracking of patient for confirmation at tertiary care level, and a system of record keeping and reporting needs to be done. So this is all from my side, and I want to acknowledge State Nodal Officer from the NCD, non-communicable disease, from the DHS, Department of Health and Services, Chhattisgarh, for providing me data and information. Thank you, everyone, for listening me patiently.